Good afternoon. I'm Mayor Eugene Folcard. On this evening, we'll be signing a proclamation for Breast Cancer Awareness Month. And before I read the proclamation, I'll turn it over to Dr. Wiltz, and in turn, he'll turn it over to Mrs. Kim Caesar, Adeline Gwynn's sister, and who passed away due to breast cancer. So, Dr. Wiltz.
Hey, good afternoon. I want to thank everyone for showing up, and especially Mayor Folcard for signing the proclamation. We've been doing this for a number of years, I think dating back when we renamed the 5K. Was it 2005?
2006.
2006. Adeline Gwynn's, and can't emphasize enough the importance of prevention and getting mammogram screenings. I actually belong to a group called Tackle. It's called Taking Aim at Cancer in Louisiana, and we just had one of our meetings last week. And the problem that we're having in Louisiana is not so much the incidence of cancer, but it's the late presentation. And by presenting late, the treatment options are not as good as they can be when you present early. So again, we're going to emphasize the fact that early detection is the best prevention. So the more that we can get folks to get out there, and particularly if there's a family history, we have genetic markings now, the testing that can predict it, and get those folks then tested early. And we have a lot better treatment today than we did several years ago. So I just want to make that point. And again, thank everyone for coming out, recognizing October as Breast Cancer Awareness Month, and everyone doing their part to try to end this.
As Dr. Wiltz indicated, our emphasis is on early detection. With COVID-19, a lot of ladies are reluctant to go to the doctor now to get detected. A lot of people this year, along with COVID-19, had breast cancer in the past, and it has come back, but a lot of it has to do with their reluctance to go to the doctor. We want to encourage everybody to do what they need to do in order to take care of their health, no matter what's going on. Even with COVID-19 and the mask, the fear is out there, but please do what you need to do to take care of your loved ones, and keep your mammograms on schedule.
Okay. Right. At this time, I'll read the proclamation declaring Breast Cancer Awareness Month. Whereas the American Cancer Society reports that in 2021, an estimated 4,020 women and men will be diagnosed with breast cancer in Louisiana, and 670 will die from the disease. And whereas Breast Cancer Awareness Month is a worldwide annual campaign in October involving thousands of organizations to highlight the importance of breast cancer awareness and education and research. And whereas, according to the Center for Disease and Prevention, breast cancer is the second most common cancer in women. And whereas, increasing the public's knowledge about the importance of early detection of breast cancer diagnosis and treatment can save lives. Whereas, Breast Cancer Awareness Month is an opportunity to unite all citizens in our community to prevent breast cancer deaths through increased education and regular screening. And whereas this October, as we race, display pink ribbons, or wear pink clothing to raise awareness, we recognize breast cancer survivors, those currently battling the disease, friends and families of a diagnosed patient, and applaud the efforts of our medical professionals and researchers working to find a cure. Now, therefore, I, Eugene Folcard, Mayor of the City of Franklin, do hereby proclaim October 2021 as Breast Cancer Awareness Month in the City of Franklin, and urge all citizens to learn and help eliminate this devastating disease. Therefore, I, Mayor Eugene Folcard, the City of Franklin, do hereby proclaim October 2021 as Breast Cancer Awareness Month throughout this city, given under my hand and seal of the City of Franklin on the 18th day of October, 2021.
Well, I can't proclaim, but I can can claim next year, if everything goes right, we will have the 5K run again, memorializing Adeline. And thank Florence, our marketing outreach from Teche Action Clinic. I don't know if you want to say a few words.
Yes, this is something that we've been doing for quite a few years, and due to COVID last year, we weren't able to do it. 2019, we had quite a few people registered to do it, but I think the weather got bad. So, and everyone basically that had registered actually donated their money, just came, got their T-shirt and donated their money toward the cause. So we want to look forward to it. Hopefully, prayerfully next year, we will be able to have the 5K run walk along with the Harvest Moon Festival.
Yes.
So we do encourage you to wear your pink and recognition.
Okay, I have a question before we sign off. I do anyway, and that is the 5K Fun Run Walk in memory of Adeline Williams, who succumbed to breast cancer. The funds for that fundraiser are used for what?
Okay.
The funds have historically been used to support women who can't afford mammograms, and we have a special, actually, cooperative endeavor agreement with Franklin Foundation for the people, for the women that live in the Franklin area, where if they don't have insurance, they can get a discounted mammogram, and those funds are used to supplement any out-of-pocket expenses. So we don't ever want that to be a barrier or prohibition of someone getting screened. So they can call Teche. Anyone listening that needs a mammogram, feel free to call us at Teche Action Clinic, and we certainly can facilitate and arrange for them.
And that number is?
337-828-2550.
Is there any extension or someone they can ask for? Because usually we get that list of...
I'll give them Florence's extension. I see she volunteered by stepping up. That's an extension.
Extension 2188, or you can call our OBGYN department at 2138.
I'm sorry. I would like to add that pre-COVID-19, Alpha Kappa Alpha also gave a brunch, and Teche Action Clinic would also help with the brunch, and they also gave mammograms to ladies in the audience, and it was amazing because some people had no means to have a mammogram, to be honest, did not know of a mammogram and wasn't worried about it because they knew it wasn't in their budget. But no matter what we asked them for, and oftentimes we can talk Dr. Wilson to donate more, you know. And he did, but the answer was never no, and we were grateful for that. But it was just amazing. It was a beautiful thing.
Yes.
I want to talk about the evolution of medicine and how, when we talk about breast cancer awareness and mammograms, how that has evolved too, because prior to, and I'm not quite sure what year, they would say get a mammogram once a year, once you turned, help me
40.
out, 40. Now that has been changed. Gary, can you tell us something like that?
Well, actually, it's been changed for colorectal cancer. We've lowered it. We start screening at 50, now it's 45. But to your point, we had a presentation last week with the group I mentioned called the Wisdom Study. And what we've come to appreciate is there's one size doesn't always fit all, because there are genetic markers, as you know, we've talked about, that some breast cancers run in women through a genetic inheritance. I think the most prominent one, that famous one, is Patty LaBelle, where all of our sisters died from breast cancer. They all had that genetic marker and predisposed them to that. But even the screening now, we're recognizing that because of the density of breast tissue in some women, some are hormone responsive tumors, and then some are better screened using an MRI rather than the traditional digital mammogram. So as we move forward, you're going to be seeing more recommendations of more specialized screening with ultrasounds and different techniques that can pick it up even earlier, as well as genetic markers that we can use.
And not to be biased, I think all of us remember Shaft, you know, John Shaft, and he was also diagnosed with
breast cancer.
Breast cancer, yes. So it does not elude men as well.
But there are some basics that everyone can follow. We particularly recommend to women, using, having a diet that's low in fat and saturated fats, and limiting alcohol to no more than 2 drinks per day, as well as caffeine products can sometimes affect women who have we call fibrocystic breast disease, and supplementing with extra vitamin E can help that condition. So those are some things that you can do as a preventive measure to take.
With the American Cancer Society, through Teche Action Clinic, I walked in there one day and they had advertisement for a sister study. And I'm also part of the sister study, like Dr. Wiltz mentioned earlier, where we take a lot of inventories and the nurses come out just to get the genetic connectors to try to come up with a cure and a cause for it. And that's one study that I was grandfathered in through Teche Action Clinic also.
Great.